is a man who never sleeps and manages to cram 36 hours into every 24. The chairperson of the Royal GP Network, Jo Scott-Jones. Joan, thanks for coming again.
Hi, Buzz.
In your busy schedule. And we've had a very busy 24 hours, really, and you've been to probably about the last 10 sessions, and I've no idea how you did it. I think you used the Harry Potter time turner, I think, to manage to go to them all. But so we've got about 10 hours of meetings you've been to, and it'd be lovely to summarise them all in the next 10 minutes. How have the last 24 hours unfolded with the conference?
Thank you, Buzz. I mean, I do not have superhuman powers, and there's been things that have been going on which I haven't been able to get to, which I really would have liked to, I have to say. I didn't get into the Rural Nurse Forum, which happened yesterday.
I'm delighted we're interviewing those after you. So
oh, fantastic.
There we are.
Oh, well, that's good.
Great.
So I don't have to talk about that then.
Nope, that's
I didn't get into the Rural Hospital Network Forum, which was happening through the day yesterday as well. But I did pop into the postgraduate generalist training program that the Royal College of GPs was running for rural teachers of postgraduate year 2 trainees. Fantastic to see that level of engagement with training people in rural practice. Certainly, that's what we need. We know that taking people into rural communities, training them in rural communities, giving them the opportunity to see what life is like living and working in a rural community really does help them to make decisions about a rural career in the future. So we're fantastic that that's happening.
So we've got some youth coming in from the bottom to help you and I as we fall off the top.
Yes, yes. I mean, and those students, some of those students will have been involved in the rural immersion programs in Otago and Auckland. Some of them may have been lucky enough to start getting involved in the Rural Health Interprofessional Immersion Program, which has been sort of established in Wellsford for quite some time, but has been extended into Whakatane and Gisborne recently, and so there's lots of opportunities for training, not just for medics, but for physios, pharmacy, nursing, in rural communities, which is great to see.
So what is new? What have we learned this year, which has been brought to the conference?
So far, for me, the other, where I spent most of my time yesterday was in the Division of Rural Hospital Medicine, because I'm a new grandfathered fellow of the Division of Rural Hospital Medicine. Thank you very much indeed. And that role, I'm also have been told I am now an educational facilitator and a mentor to another rural hospital registrar. So that there's been an exponential growth in the number of people who are going through that fellowship training program. And
we talked about this yesterday. There's certainly a need being created, especially I was talking to Chai Chua, who's talking about the devolution of work from the secondary sector to the primary sector, and so obviously we need to expand our workforce accordingly. Are we in a position to fill that hole, do you think?
No, I don't think we're in that position to fill that hole completely as yet, but the bare bones of what we need, I think, is in place. It's not just about the extended role of the individual health providers, so that pharmacists, nurses, doctors are working at the peak of their scope. It's also about having the technology that enables that to happen as well. And I'm really looking forward to the presentations later on in the conference about what the cutting edge technology that's available to us.
Fair point too. And we've also had a few political sessions as well, and you managed to attend some of those.
I was at a couple of general meetings that were held last night, the Division of Rural Hospital Medicine and the rural chapter of the College of General Practitioners as well. And it's really heartening. I find it fantastic that organisations like the Rural Hospital Network, the Division of Rural Hospital Medicine, the rural chapter, choose to use this opportunity to come together to run those business things which are necessary in the life of any organisation. But great that they use the rural network as their opportunity for that. You know, it really enhances the life of these conferences and increases our ability to connect with each other across the whole of the health sector. Something I'm really looking forward to next year is expanding that into more community organisations. We had our Rural Health Alliance New Zealand Day, Aotearoa New Zealand Day on Wednesday, and I just heard today of another couple of member organisations for RANs. So next year I can really see that being a big feature of the conference and having a lot more of the community voice here, which I know is one of Chai Chua's wishes that he wanted for the health sector as well. So it certainly is our wish as well.
That's fantastic. And we had a tour of Flavel as well talking this morning. I didn't manage to get to his. Did you manage to get to his session?
Yes.
So what was his message to the Minions?
Te Rotorua was talking about the Māori Party, of course, and its focus on whānau ora, the appalling statistics that still remain of that discrepancy between Māori health outcomes and Pākehā health outcomes, and through initiatives like whānau ora, the hope that we'll start to see some of those issues being addressed. The problem we have is that the real outcomes that matter to people, as a diabetic, do I still have both legs? Am I blind? You know, am I on renal dialysis? Those sorts of problems take an awful long time to arise. So it's finding the measures that are useful for us to determine what matters to people about their health, that can be measured and seen to be affected in the short term. My feeling is that's going to come to be quite a subjective measure. We're going to be asking people more about how they feel about their interaction with the health system. Did they get what they felt that they needed? You know, do they feel that they've moved further on? They're very soft measures at the moment, but they're really important. If we don't get that engagement of people into the community, from the community with their health services, we're not going to get the long-term outcomes that we really want. But yeah, it's a long road.
It is, it is. Are we on it? Are we on the right track, do you think?
Absolutely. I'm excited about my role in rural health. As chair of the Rural General Practice Network, oh gosh, I did it myself. As the chair of the Rural General Practice Network.
Just say GP, you'll be covering all the problems there.
The Rural General Practice Network, I have to say, covers a lot more than just rural general practitioners. Yeah, I find myself having to commonly sort of correct people on that, so typical that I would nervously sort of stumble on those words. But the Rural General Practice Network is an organisation which is strongly involved in moving a lot of these ideas forward, in taking some of the ideas that Te Rotorua was talking about and Chai Chua was talking about, and actually implementing them, which yeah, it's great to be involved in the policy development, but you know, it's exciting. It's exciting to be doing what we're doing.
That's fantastic. So, in 10 seconds, are we in good heart?
Yes, I think we are. I once attended a Rural General Practice Network conference where I felt everybody was so flat and down, and it was because of the environment that we were working in at that time, and this was some 10 years ago. Now, you know, people are smiling and I think enjoying the process. There's, you know, it's a great feeling in the conference floor at the moment.
Fantastic. Well, Joe, I really appreciate you coming. Thank you very much indeed.
Thanks again, Buzz.
You've got